Many men over 50 continue their sexual habits in private, assuming that what worked in their 30s still works the same way now. But what most don't realize is that the hormonal environment, blood flow capacity, and recovery patterns of the body have quietly changed. This doesn't mean something is wrong. It means the body is responding differently to the same behavior. And when those responses change, awareness becomes important. If you're over 50 and have never thought about how your body processes sexual activity differently today than it did years ago, this is something worth understanding. Hello, I'm Dr. Ananya Rao. I work with men's health and urology, and here on this channel I explain medical topics in a clear and practical way, so you can better understand your own body and health. Today, I want to help you understand what actually happens in your body when it comes to masturbation after 50. Not myths, not shame, just calm, medical information. Let's start with how your body manages sexual response. During arousal and ejaculation, blood flow increases to the pelvic region. The nervous system coordinates muscle contractions, and hormones like dopamine and oxytocin are released. After ejaculation, the body enters a recovery phase called the refractory period, where arousal temporarily decreases. This happens at any age, but after 50, some things change. Testosterone levels naturally decline. Blood vessels may lose elasticity. The prostate often enlarges slightly, and conditions like diabetes or high blood pressure can affect circulation and nerve signaling. These changes don't stop sexual function, but they do change how the body responds and recovers. One important effect to understand is prostate health and ejaculation frequency. There is ongoing research into whether regular ejaculation may be associated with a lower risk of certain prostate issues. Some studies suggest that men who ejaculate more frequently may have a slightly reduced risk of prostate problems, possibly because regular ejaculation helps clear prostatic fluid. However, this does not mean masturbation prevents prostate disease. After 50, the prostate naturally tends to enlarge, which can affect urinary flow and ejaculation comfort. While masturbation may support circulation, it does not replace medical evaluation. Regular checkups remain essential. Another important effect involves testosterone and sexual drive. Testosterone declines gradually with age, especially after 50. This can reduce libido, but it does not eliminate sexual desire. Masturbation causes temporary hormonal changes, but it does not significantly lower testosterone over time in healthy men. What many men notice instead is a difference between desire and performance. Erections may take longer, feel less firm, or require more stimulation. This is usually related to circulation and nerve sensitivity, not masturbation itself. Sudden or severe changes should always be discussed with a doctor. Pelvic floor health is also an important consideration. The pelvic floor muscles support bladder control and sexual function. With age, these muscles can weaken, especially with sedentary habits or weight gain. Moderate sexual activity can help maintain muscle tone, but excessive force or tension may cause discomfort in some men. Changes in ejaculation volume or intensity are often normal with age. However, pain, blood in semen, or persistent discomfort are not normal and require medical evaluation. There is also a psychological and emotional aspect to consider. Sexual activity releases endorphins and oxytocin, which can support mood and reduce stress. For men over 50, maintaining a healthy sexual connection with their body can support emotional well-being. However, there is a difference between healthy behavior and compulsive behavior. If masturbation becomes a way to avoid intimacy, numb emotions, or manage stress excessively, it may signal emotional distress. Sexual health is physical, emotional, and relational. All three matter. So when does frequency become a concern? There is no universal right or wrong number. What matters is how it affects your comfort, daily life, and relationships. If you notice irritation, soreness, reduced sensitivity, or frustration, it may be worth reflecting on your habits. Certain medications can also affect sexual response, which sometimes leads men to misinterpret what their body is telling them. Self-awareness is more important than self-judgment. Every man's body is different. Hormones, medical history, lifestyle, and emotional health all influence sexual response. This information is educational, not diagnostic. If you experience pain, blood in semen, sudden changes in erection quality, or concerns about compulsive behavior, speak with a urologist or healthcare provider. Sexual health is part of overall health, and it deserves care and attention. Now I'd like to ask you something. Have you noticed changes in your sexual health after turning 50? Do you feel confident knowing what is normal and what deserves attention? If you feel comfortable, share your thoughts in the comments. If this video helped you understand your body better, consider subscribing. I post new content every week about men's health, explained calmly and responsibly. In the next video, we'll talk about erectile changes after 50 and when circulation becomes an issue. Take care of your health. I'm Dr. Ananya Rao, and I'll see you in the next video.